Hospital for the internal medicine department. Go to any of the schools that lost?
Oh no.
Ah, okay, thank God.
I did.
You did? Let me guess, Prempe.
No, Google High School.
Oh, sorry. Oh, sorry. Oh, how does it feel to see your school crash out?
Oh, I mean, it doesn't feel so good, but I mean, in this life, nothing is really given. Right? You have to fight for it.
Oh my gosh, I'm sad the Owusu people are talking like this. It's quite unfortunate. Anyway, but today we're talking about stroke. I mean, it's one of the things that you would commonly hear, even medics or non-medics talk about. Let me start with you, Dr. Gyabaah. For somebody who is not into medicine, what should they understand by a stroke?
Okay, so stroke basically is a condition that affects the brain, and it manifests on our body. Most commonly, we see it as weakness on a part of our body. So, for instance, people may be doing their normal activities or work, all of a sudden, then they feel weakness on maybe their right side of the body or left side of the body. For some people, they will have deviation of their mouth and all that. So it's actually a brain, because the brain controls the body. So when you have any issue that is affecting the brain, it manifests on your body. So it's a vascular problem. It has got to do with the blood supply to the brain. So when you have an issue with the blood supply to the brain, you tend to manifest it on your body, and which will manifest as weakness. On part of the body.
Okay. Dr. Oppong, let me come to you briefly. So, how common are strokes? Like, how common are they? Because you won't listen to any ad on the radio without hearing stroke. Is it that common?
Oh yeah. For looking at the statistics from Kwamfanochi, stroke is becoming very common. Yeah. So maybe now in your community, you're not really seeing people who have stroke, but we at the hospital, we see a lot of people reporting with stroke. So close to a week, because of the stroke thrombolysis team. Sometimes you can even have about 2 cases, at least 2 cases
a day. A week?
Yes.
Okay.
And you can even have more. There are times you can even have about 4, 5. It depends. So it's actually becoming worrying.
It's quite common.
It's very common.
All right. Sure.
I mean, worldwide is one of the. I mean, it is known that every 3 seconds somebody gets a stroke in the world. So that's how bad the stroke is.
Every 3 seconds.
Every 3 seconds.
Wow.
Because it's more than 12 point something million people get strokes roughly in a year. So you realize that when you do the statistics, roughly every 3 seconds somebody is getting a stroke somewhere. And I mean, studies have shown in Ghana that when you take 1 out of 3 people, I mean, one of them is likely to, when you take 3 people, one of them is likely to develop a stroke in their lifetime. So that is how common and how.
So when you take 3 people, one of them is likely to develop a stroke in their lifetime. Okay, Dr. Kwarteng also. Usually, we're all not sure why someone would get a stroke. Like sometimes they'll say, "Oh, but I saw him this morning; he was fine." And then you ask about the person later in the day, they say, "Oh, he's had a stroke." Do we know what actually causes a stroke?
Okay, so there are known causes of stroke, and there are also some things we call risk factors.
Okay.
So these risk factors makes you more likely to get a stroke. Uh-huh. So some of these, I'll start with the risk factors first. So some of these risk factors include hypertension. Hypertension, like your blood pressure is being high most of the time. So with that, apart from the hypertension, diabetes. If you have diabetes, it makes you more at risk. And there's also something we call cholesterol or fat in your blood, right? When it gets so high, that also increases your risk for getting a stroke. So the factors I'm mentioning, the risk factors I'm mentioning, are what we call modifiable risk factors. Modifiable means that you can do something about it. If your blood pressure is high, it can be controlled. If your fat levels are high in the blood, that one can be controlled as well. And then if you have diabetes, that can also be managed. But there are also some factors which are not modifiable, like age. Stroke is commoner in the elderly, right? So that's one. And then race. Stroke is commoner in amongst blacks. So that's those ones you can't change. But there are some other factors which you can change. And it doesn't really give you, apart from, let's say you have diabetes, having something from the diabetes, usually with hypertension, it doesn't really give you any warning sign. And most often, it's only when it gets to the extreme stages, that's when you start having, let's say, headache, or something to really show that you have the hypertension. So it's very likely that some people may have stroke without having any previous symptom to show that stroke is pending or something. So it can happen all of a sudden without you knowing about it. I think that's why it's very essential that you try and go to the hospital, at least so that they check your blood pressures to know that it's fine, your blood sugars, and then the fat in your blood as well. I mean, there are also other lifestyle habits that can make you at risk of getting a stroke. That one can also be at risk. If you are someone who is sedentary, sedentary means like you sit around one place for long without exercising. That can also increase your risk. If you are someone that smokes cigarettes too, a cigarette increases the risk of stroke in diverse ways. And when we talk about smoking itself, it doesn't really mean like the person that smokes. Those that are around the people that smoke, right, can also end up being at risk. So there are these are some of the factors that makes it more likely for you to get a stroke. So if you are indulging in any of the things that I've said, if you have hypertension that's not well controlled, all these can make you more likely to have a stroke.
Okay. If you're just tuning in, this is 107.9 Orange FM, and already your messages are coming in on the show on 05939 32993 0593932 If you've got a question about anything that we are talking about, you can send your comment. It can be a text or it can be a voice note. Either way, we will definitely ask our guests, and they'll give you the answers that you require. Someone sent a message and what she's asking is that does stroke run in families? Can you ask my guests? Because 3 of my parents' siblings have all had stroke, and we are all beginning to wonder if it runs in families. Bosses, that's stroke running families.
Okay, so looking at one of the components of the cause of stroke, especially with hemorrhagic stroke, there's a genetic component of it where some people who have what we call arteriovenous malformation. So for such people, the way their arteries and then their veins that run in their brain are formed, the connective tissues that strengthen them are not as strong. So for such people, when they also get hypertension, it puts them at a higher risk of developing stroke. So if there's something like that in your family, that means that if hypertension also comes in, it puts those people in that family at a higher risk of developing a stroke.
Okay. So it's not like it runs in families, does it? Like
Yeah,
that's the
the
that's the
other,
question.
the other thing is that there are some genetic association with stroke. So, for instance, there are some genetic mutations that tends to run in some families, and but of course, that is not common. It's not common that you get it, but it can be, you can have that genetic mutation running in some families. But as I said, it's not a common thing that you most often come across. When you look at the Siren study and then the interstroke study, Africa study that was done here in Africa, you realize that when you look at the genetic component of the causes, it's actually very small. Most often is the hypertension, the diabetes, and the high cholesterol levels that are the common implicators in stroke. Yes, so to answer the question, yes, there is a genetic cause to stroke which runs in family. But as I said, this is not something.
It's not a big part. It's a small part.
Just a small.
Okay, all right.
Just to add to what they've already said, so I would like to say that, especially in the context of the question the person asked, it may as well also be that particular families tend to be exposed to the same things, right? When it comes to the risk factors, right?
Okay.
So that may as well be the reason. So there are some, because in your family, all of you are taking the kind of the same meal. You are being exposed to around the same things, and again, the risk factors, right? Like hypertension, like the high lipid, all these risk factors have some environmental component to it. So it's very true that you may see a particular family having
it looks
stroke.
like everybody in the family has a
having
stroke.
But it could just be that the risk factors, they are having similar risk factors. That's why they are having a stroke. And it's not so much of the genetic component as has been said already.
So you may all be exposed to the same thing because you live together.
The habits yes are similar, so that I think that has that play a major role rather than
it's interesting to hear that because sometimes people draw associations very easily. Oh, ebusua wey do be our hypertension, or like this family everybody is hypertensive, or this family everybody is very non-active. Let me put it like everybody is very sedentary. So when one person gets a stroke, next thing you know, like the mom, the dad, everybody seems to be having the same problem. But like you're hearing, it's not as if it runs in families, but you may all be exposed to the same risk factor. Is there at what point do we say that somebody has a stroke? Because let me read for you a listener's comment shortly. Okay, so what she's saying is that we went to hospital with what I thought was a stroke. My mom could not talk, and she walked very slowly. After we went to hospital, we were told that it is not actually a stroke. We did a CT scan that did not show anything. But the following day, she was well. So she's asking, did she have a stroke or not? Bosses, this one is for you. Because from her message, it appears that, okay, someone may have said that from what her mom is exhibiting, it's like she's had a stroke. 24 hours later, it's like nothing happened. It's like the person is back to themselves. So she wants to find out, like, does that constitute a stroke, and should she be worried?
So usually, as I said, we have two types of stroke: hemorrhagic stroke and then the ischemic stroke. The hemorrhagic has to do with the blood vessels that are supplying your brain. So that blood vessel, let's say your blood pressure goes so much high that the blood vessel ruptures. Then now you bleed into your brain so that the portions of your brain that is supposed to get oxygen and nutrients are no longer getting it. Then the cells begin to die. Then you have the deficits. Then we also have the ischemic component where there is a clot that is blocking the flow of blood in the vessels that are supplying your brain. So there are situations where people will have a very small clot that will block, but after some time the clot moves away. So they might transiently have features of stroke. So that's what we call transient ischemic attack. Usually it doesn't last for more than 24 hours. So usually it should resolve within 24 hours. So the person will present with the classical features of stroke, weakness. The person might not be able to talk. The person might have drooling and all that. But within 24 hours, it might resolve. And the person will think that it wasn't a stroke, but it's also a subclassical type of stroke, of the ischemic stroke. But it resolves within 24 hours. But if it progresses after 24 hours, 48 hours, then it means that the clot had come to stay. And that one, the prognosis changes. You will have the symptoms for quite a longer time until you are treated.
But someone may ask, I have not had an accident. I have not fallen down. I have not hit my head against anything. How does a blood clot end up in my brain? Like, I've had no trauma. I'm going about my daily activities. Because usually we all think that, maybe when you fall, when something cuts you, then you have a blood clot. How does a blood clot end up in my brain?
So for the blood clot ending up in your brain, most of the times, with the same ischemic stroke, we have two types. We have the thrombotic stroke and then the cardioembolic stroke. So with the cardioembolic, that means that the clot was from your heart. So,
the clot was from the heart?
Yes. So there are people who have heart issues. Let's say the person has atrial fibrillation where the rhythm of the heart is not beating as expected. And because the rhythm of the heart is not beating as expected, blood tends to stay in the heart a bit longer. And the more blood is staying in your heart a bit longer than usual, it begins to clot. And after some time, that blood that clotted, it would like they would say that it throws off, and then now it moves into your brain, and it will go and block the vessel.
Oh, okay. So then the clot is coming from your heart.
It is coming from your heart.
Okay. All right.
Yes, and then apart from that too, there's other people who have other heart disease like they have heart failure. Heart failure too can also cause the same thing. Coronary artery disease can also lead to the same thing. So there are some people who might be having a heart problem and they don't know. That's why there are some people who, when they hear bad news, I remember there was once a situation like that. The person had a bad news and then developed a stroke. And when we went in, we realized that there was a clot. So where did the clot come from? So the bad news triggers you to be anxious. There could be a transient atrial failure. Your rhythm might change.
Yes.
And when the
you
rhythm
start having
changes,
some severe palpitations
and all that, then the clot will form and then it will just dislodge. And you go and block your artery, your coronary artery, and then before you realize you've developed a stroke.
Good morning to all fans of Manchester United. Now I know.
And another thing is that there are some people too, it's not from their heart. It forms within the vessels itself that are in the brain. So there are risk factors like dyslipidemia, where the cholesterol levels are so high, and these cholesterol levels tend to form what we call atheroma. So it forms. It affects the vessels in the brain, and in the vessels, it forms a plaque. So you realize that it will now occlude or
block some part.
Yes, to block some part, and it's still a clot that has caused that to happen.
If you're just tuning in, this is 107.9 Orange FM, and we're on the Orange Health Lounge. And this morning, we're trying to, break down strokes and what causes them and what puts you at risk. We're going to come to the science and explain it further for you to understand. If you've got any question to ask, if something is bothering you about the conversation, there's something you want to clarify, feel free to send that on 059-3932-993. That's on WhatsApp, 059-3932-993. You can send a voice note in Twi or English. We'll respond to that. Or if you're watching us on YouTube, you can also drop your comments there, and we'll definitely answer it for you. Good morning to you, Priscilla Abrefio Pariado. I'm sure that's Dr. Pariado. You're also watching us on YouTube. Thank you for doing that. So 0593932993. That's the WhatsApp line, only for WhatsApp. We'll open the phone lines in a bit. Yes, someone saying something.
Yes. So I was going to just adapt to what he said. Yeah, so when we talk about all this hypertension, diabetes, and the risk factors that we talk about, what it means is that it doesn't mean when somebody has hypertension, the person is going to have a stroke, or if the person has diabetes, the person is going to have a stroke, or if the person drinks alcohol, automatically they are going to have a stroke. No. So it's all because of the formation of this the thrombus or the clots, because when you have some of these conditions, or when you are engaged in some of these risk behaviors, your chances of forming these clots is higher compared to somebody who doesn't have those conditions or who is not engaged in such behaviors. So because when you drink alcohol or when you have diabetes, it affects your blood vessel and increases your risk of forming a clot. So what it means is that if you have these risk factors, it doesn't automatically mean you are going to have a stroke, or if you drink alcohol or you take in, you have a sedentary life or high lipidemia, but you have a higher chance because your risk of forming a clot is higher, and this clot can dislodge and block the vessels that is supplying a particular area of the brain, leading to the stroke. So that is what we mean when we talk about these risk factors. It means that you have a higher chance of forming a clot, and these clots can also dislodge or form in the vessels supplying the brain and lead to stroke.
All right, so a listener sends a message. He says that, good morning, I grew up in a village where our mama used 3 stones and firewood for cooking, but there were not any kinds of stroke or related diseases. He's saying that, but now it's something else. He's saying his question is that, is it something that has changed? So, okay, so we do get, some of these concerns that, is it because our lifestyle has changed? Is it because now we've moved away from using earthenware pots or clay pots? Because I've heard that before. I can't seem to remember the guy's name, but there's a very popular radio person in Accra who says that, you don't have to bath with a plastic bucket, use a metal bucket. You don't have to, because of microplastics, you have to use a clay pot. You don't have to use silverware. Do those things contribute in any way to hypertension or getting a stroke? Because, like he said, there's that sort of thinking that because we are modernizing, we are seeing these diseases. Is that what it is?
Yeah, so the risk behaviors that my brother spoke about earlier, because you realize those days people could go to the farm and work for longer hours, and then before they come home, and whatever they eat it actually gets metabolized very well. And realize that there wasn't much sedentary lifestyle, and even people could walk from Kumasi to Sunyani because there was no car. A lot of things has changed now. You realize that now life has become more simpler and more easier than it used to be. And as it's becoming that way, I mean, your risk of also having other things also goes up, because you realize that a sedentary lifestyle has become more and more these days, because people, I mean, easily can move to Accra and Kumasi. People could walk to just go and buy salt those days. They could walk to Salt Pond just to buy salt and come back. Now you can easily get your salt anywhere. So you realize that our lifestyle too has changed. I mean, we are adopting, I mean, the foreign life more, and we tend to be getting their diseases also more. So the lifestyle changes has contributed to the increase in the stroke that we are seeing now.
Okay. So so there's some truth in that, right? Is there some truth in that our lifestyle is now influencing
Yes.
our risks?
Definitely.
Yes. And to add to that, another thing that has also changed, and it comes in with modernization, is, modernization has brought a stressful lifestyle. So, yes, because back in the time, being a parent, you were not as stressed as now. Right now, to even buy diapers, people were not buying diapers then, they were using napkins. And they will wash the same napkin and use it for the same child. But now, you have to buy diapers. Plenty things, like even the baby food has changed. Like, a lot of things are changing with modernization. So it tends to put a lot of stress on us. And you know what stress does to us? Stress causes a lot of free radicals in our system. Such that even if your cholesterol levels are high and free radicals also increase, there's something called lipid peroxidation. When those cholesterol, the LDL levels become oxidized, they tend to stick more to the vessels. And that's where it starts to cause the thrombus formation. Then the thrombus will form.
Okay.
And before you realize, already you had a risk factor of high cholesterol, you had a risk factor of hypertension, the risk factor of diabetes, then a stroke also what comes.
No, but one of the ways to also reduce stress is to go and sit outside and enjoy the nighttime ambience, which comes with a lot of vice. So sometimes in trying to reduce your stress by sitting outside, then the other things to come and add to it. It's hard though. Anyway, so one of the things about what we're talking about, like stroke, is that it appears that once someone has a stroke, it's like that's it. Like the person is stuck there. Is it possible to reverse a stroke? Dr. Kwarteng, someone is asking, is it possible to reverse a stroke?
Okay, so possible to reverse it is possible.
Oh, okay.
That's why, I mean, time is of essence. But then again, it's not that it's always reversible for everybody. Just like one of the listeners sent a message that there was a situation where someone had some symptoms that was speaking more for a stroke, but then within 24 hours, the symptoms resolved. So the issue with a stroke is that it's either blood supply to a particular part of the brain is interrupted, right? And then once that happens, there are with every minute, you are having changes in your brain, right? If the blood supply is not restored, it's been shown that you can lose as many as 2 million brain cells per every minute of blood supply being interrupted to that particular side of the brain. So just imagine if you have blood supply to a particular part of your brain going down, and then somehow all of a sudden that blockade is sort of relieved. At that point in time, your brain may recover, and you may not see a lot of changes, right? So some people may actually have normal function of every part of their body. But then if it takes a longer time for that blood supply to be restored again, that's when you have a lot of damages. And one thing that we'll have to know is that no matter the stage in which it has got into, it's always better you come to the hospital earlier so that we start our intervention. But then even if it gets late and then you've seen a lot of changes in your body, maybe there's weakness, and the weakness is so much that you're not even able to walk, there are some measures that we can take that helps in the recovery. So, I mean, there are some people who it has gotten to the extent that the change has become irreversible. So no matter what you do, the change has already occurred. So all that we'll be doing is to give you some treatment that will support you, and then so that you'll be able to recover some function to work. So there are some cases where nothing really can
be done.
Yeah, be done to restore. No, it's not like nothing can be. Always there's something.
There's always something that can be done.
There's always something that can be done. But then it can get to the state where nothing can be done to restore your previous function.
Oh, okay. To restore your previous function.
How you used to be previously, right? I mean, there are cases of people that have had a stroke for some time, for some years now, and then now you still see them limping, right? So that's the effect of the stroke, and it's just because that it got to the extent where the changes were not reversible. You get it?
Let me push you further. Someone is asking, Doc, ask your guests, are strokes spiritual? I know the person sent the text earlier, and I just read it and decided to ask. I wasn't going to ask. I answered the person, but I'm asking so you tell the general public. Because, case in point, there's a very popular celeb, Moesha, who's had a stroke, and it's like she's going to churches. So, Dr. Oppong is laughing. She's going to churches, and people get stroke, and they go to church. I'm not saying going to church is a bad thing, but is there any component of a stroke that is spiritual? I'm asking for the general public.
I mean, this is a difficult question to answer.
Okay,
but
all right.
I would like to say that when it comes to stroke, right, the environment, or there's a rule for there's a social component to it, right? There's a social component to it. So someone cannot say that, let's say, going to church is not really beneficial, because I mean, people that belong to some particular group of people, like a church or some other group, right? They are very supportive. Even if you have a stroke, I mean, all these people are necessary for your recovery, because you hear some words of encouragement. There are times where, I mean, some particular people belonging to a particular group or sect are less likely to be exposed to certain risk factors, right? So let's say if you go to church, you are less likely to get into
Drinking
some lifestyle,
and
smoking. So all these are quite beneficial. And in fact, when someone have a stroke, we actually want everyone to be involved, right? Which the church is part, right? So we want everyone to be involved, and all these people tends to help, I mean, the one that has gotten the stroke. And you know that church is also a social gathering. I mean, people go there, they are happy, right? There's stress over there too, and then the stress is less, right? And again, when you pray too, it's more like you are you have that feeling that God can
heal you.
Yeah, heal you or carry all your burdens. So all these are very beneficial. So I mean, with the spiritual component, as I've explained, right, all these are things that can help reduce your risk.
So the spirituality might reduce your risk factors.
Yes, definitely.
Okay.
I mean, so there are some other things, some other issues that maybe your listener wants me to address now, which I may not be able to address at the moment. But maybe in another setting, I would like to speak further with your listener.
Okay.
But I mean, the cause of the stroke, as far as we are aware, is not spiritual. Just as he mentioned, I mean, when you are involved in some of these spiritual activities, it may reduce your risk of getting it, or even if you get it, it may provide some support for you.
Yeah.
But as the cause of the stroke being spiritual, and you avoiding going to hospital for care and just concentrating on spiritual issues, that is not it.
Because the listener comes back and says that sometimes, let me say it in Chile, because waboni dia so intina wenya stroke no. That's what he just sent.
African electronics.
That's what he just sent.
But,
the stroke.
As far as we have investigated or we have research into stroke, we have not been able to find
we've not established that African electronics is not part of it.
Of course, that's why African electronics, nobody knows how it works. But I mean, honestly, scientifically, there is nothing like spiritual cause of stroke. There's always a risk factor that is causing the stroke.
So, but at least I get what Dr. Kwarteng also said. He said, it's church, it's a social gathering, it's a social culture. If you probably are diagnosed with a stroke, going to church is also a support system for you, because people are empathetic. If you need assistance, people will definitely help you. So go to church. It's important. So, go to church.
I would like to add to that, and I would like to advocate that, irrespective of the perspective out there, no matter what, if someone should have symptoms of stroke, the first line is that the person should come to the hospital.
Yes.
It's very, very important.
Yes.
Even if you are thinking someone has cursed you,
just
come to the hospital, because sometimes what you might be thinking is a stroke might not be a stroke. There are times people come to the emergency after we've done the assessment. You realize that the person presented with symptoms of stroke, but it's not a stroke.
It's not a stroke.
It might be something else. It could even be a tumor. It could even be an infection of the brain.
Of the brain.
That is causing that. So there are other things that can lead you to having that weakness, sort of, which might not be a stroke.
So just having, let's say, like the one-sided weakness or being slow, it's not like, each one of them is a stroke.
Yes.
It may be something else.
It may be something else. So it's investigation, clinical investigation, that will help us decipher what it really is. And apart from that too, as my brother was saying, time is of the essence, because if you don't come early, for instance, imagine you have hemorrhagic stroke and you don't come early, your prognosis is very bad.
So hemorrhagic stroke is the one that you bleed in the brain?
You bleed in the brain.
Okay.
Imagine you are bleeding in your brain and it continues. If you are not careful, you might lose your life, because when you compare the fatality between hemorrhagic stroke and ischemic stroke, hemorrhagic stroke is more fatal than ischemic stroke. Apart from that, even if it's an ischemic stroke and you come early, we advocated that when you come early, we can even do something for you. At Confanochi, we started the stroke thrombolysis project. And the essence of that project is to save lives, to save people who, notwithstanding, could have gotten a real stroke and would have spent more. So if you come early and you're able to undergo thrombolysis, it helps to salvage your brain from all the sequelae, all the complications that can even follow suit. And we advocate that you come early. By 2 hours time, you should be able to reach the hospital.
By 2 hours?
Yes, before 2 hours, you should be there, because when you come, we will do other assessments for you. And then all those things will take time, because you have only 4.5 hours to receive the procedure we are talking about. After 4.5 hours, the procedure doesn't really benefit you.
Okay. We're going to come to that in a bit. If you care to join us on WhatsApp, it is 05939329993. 05939329993. That's just WhatsApp. You can send it as a text. You can also send it as a voice note. We would play it and then everybody would listen to your question. I'll open the phone lines in a bit. Good morning to you, Efia. So Efia's question is quite straightforward. So she's saying that, okay, so she has two questions. She's asking, can children get a stroke? And then she's saying that her father had a stroke and lost all his memory. He couldn't write. He couldn't do anything. He could barely talk. What kind of stroke is that? So can we answer her two questions? First of all, can children get a stroke? Or do children get strokes?
Yes, children also do get stroke.
Okay.
As we mentioned, I mean, there are certain disease conditions, for instance, people with sickle cell at risk of getting stroke. I mean, they're at risk of forming thrombus and getting a stroke. So, and there are other risk factors that also put children, people could get familial hyperlipidemia, and they could also put them at risk of getting. So children do get stroke as adults, just that the risk factors is a bit different when it comes to children compared to adults.
Okay.
Concerning the second question, no, the brain is such an, I mean, it's a very interesting organ, and it controls virtually everything. There is a part for memory, there's a part to help you talk, a part to help you understand, a part that help you move your limbs and all that. So depending on the area of the brain that is affected, you tend to have a manifestation on you. So for instance, if people get stroke and they are not able to talk, mainly because the part of the brain that helps you to talk has been affected, and so you'll not be able to, you find it difficult to talk. For some people, they're able to talk, but they don't even understand what you are telling them, because the part of the brain that helps them to understand has been affected. So depending on the area of the brain that gets affected, you get a manifestation. But generally, after stroke, there is what we call vascular dementia, because the blood supply to the brain has been affected, and so it generally affects the person's function in terms of memory. So one, depending on the area of the brain that is affected, you will have issues concerning that.
Okay, so so Dr. Gyabaah, what you're saying is that if the stroke affects the part of your brain responsible for speech, for instance,
Yes,
it means that you may not be able to talk.
you have problem with speech.
So the stroke can affect different parts of the brain that does different things for you.
Yes. So for instance, when you take the brain, as I mentioned, there is a representation of everything on your body in the brain, and whatever you do is controlled by the brain. That's like the powerhouse. So everything. So if the part of, I mean, the brain that helps me to talk is the area that has been affected, or is the blood supply to that area has been blocked, then I mean, the function will be affected, and so I will not be able to talk. If it is a part of the brain that helps me to move my right limb, or right hand or left hand has been affected, then I will not be able to move my left hand or right hand. For some people, all that they when they get stroke, all that is affected is their ability to feel things, their sensation. It's just the sensation. They are able to move their limbs and do all things, but they are not able to have sensation. I mean, they are not able to feel things well, because the part of the brain that helps you to feel or recognize things has been affected. So depending on the area of the brain that is affected, that will tell the manifestation on your body. I hope that is a bit.
Can the stroke affect more than one part of your brain, such that you can't talk, you can't, or it's kind enough to affect only one side?
Okay, so when we talk about stroke, we talk about vessels, vascular, and its territories in the brain. Okay, so every part of the brain has a blood supply, and depending on the level at which the blockade is, that will tell us the manifestation. So there can be a stroke that is affecting the person's from the frontal part of the brain all the way back to the occipital. Do you get it? So for those people, they'll have a very large area that has been affected, and so their manifestation will be a bit different from somebody who will have a stroke that is affecting a smaller blood supply to a smaller area of the brain.
Okay.
So the manifestations are different, but as I said, the vascular territories, depending on the level at which the blockade is, or at which there is a vessel rupture, that will tell us, or that will tell you the manifestation on the body. So you can have a very large area of the brain being affected. You can have a very small area of the brain being affected, depending on the blockade, the level of blockade.
Okay. So, Mami wants to find out from you that. Okay, she's saying, can they? It's okay, right? So she's saying that can they confirm if taking something like garlic can help melt blood clots? Because that is what I have heard. So I take 1 garlic every day. This is a very common question when it comes to strokes. I don't know how often you guys see it at your end, but it's quite common when it comes to stroke. There's this perception that some supplements or especially garlic, can melt blood clots. So people swallow garlic every other day, hoping that it will melt some blood clot. Is that what it is?
So for garlic has this antiplatelet effect. So it doesn't melt blood clots as people think, but it rather thins the blood.
Okay.
So it makes the blood thinner, so that the blood flow would be very progressive. Like it's not there will be no stasis in the blood, such that it can cause the blood to clot.
Okay.
So if you are someone who wants to prevent getting a stroke, or maybe you're at high risk of developing hypertension, or you're at high risk of developing even hypercholesterol and all those things, and you want to add garlic to your diet so that your blood circulation will be free flowing, no blockade, nothing, no clot formation, that one is advisable. But it's not like if you have stroke and you take garlic supplements, it's going to cure the stroke. No.
Okay.
Okay, so just to add to what he has said, I think no one should really think that there is one sort of solution to this whole problem of stroke, that you taking garlic every day will somehow prevent you from having a stroke. It doesn't happen that way. And there is a saying that you can never outrun a bad diet, right? So you can't decide to eat anything you want, and then after that you go and exercise, thinking that maybe your exercise will somehow prevent the stroke from happening. Right?
Oh, sir.
No, it doesn't happen that way. So you have to. So all these risk factors needs to be addressed. So when it comes to diet, it's very helpful that you take in more fruits, more vegetables, which garlic is part. So it's not just garlic.
It's not just one thing.
Yes, it's not just one thing. So there are like a lot of nutrients in some other foods as well that helps reduce your risk factor for getting the stroke.
No, but Dr. Kwarteng, you would agree with me that like sometimes you see we hear one thing, and then it's like the whole world is hooked on it. I don't know if I don't know if you came to meet the Moringa era.
Yes.
To the point where we had Moringa bread. I mean, it was that bad.
So
we had Moringa bread. I'm telling you.
I can understand why.
Because we've gone through Moringa, we've gone through noni, we've gone through ginger. I think now we're at garlic.
Yes. Oh, the issue with stroke is that stroke can be very devastating.
Yeah.
And especially if you know someone close who has had a stroke, right? So I mean, whatever comes up, whatever information you hear,
you want to try it.
You want to try it. So that's the nature of us humans. But I think the whole education that needs to go out there is that there isn't one stop solution to this whole problem of stroke. That's why we've mentioned sedentary lifestyle.
Yeah.
How you should be more active, exercise. I mean, it's advised that within, let's say, a week, you exercise at least 30 minutes every day. Walking is good. Aerobic exercise like walking or cycling. Something like 5 times a week, giving you just around 150 minutes of exercise. That can help you. When it comes to diet, you are supposed to cut down on a lot of these processed foods. I mean, a lot of these fast foods. Like a lot of saturated fats in those foods that can also affect you, right? So it's more with lifestyle, diet, reducing stress. So all these are small components which will in the end add up to make a lot of change, right? So you shouldn't just be. It's very good that the person is trying healthy lifestyle changes, which is I would like to commend the listener for that. And however, there are also other things that she can do which would help her and then reduce the risk further.
Okay, so
I want to add
sure.
to that. I think as my colleague is saying, so it's a holistic approach, as he's saying. So there's something we call dash diet. Dietary
diet
approach to stop hypertension. And you realize that dash diet, it doesn't only stop hypertension, it can even reduce your risk of developing a stroke. It can reduce your risk of developing hypercholesterolemia, where your cholesterol levels will go high. And the dash diet it's not just taking garlic. Because the dash diet will tell you that take more fruits and vegetables. So if you are taking fruits and vegetables, garlic is just a small component of that. The dash diet will tell you that instead of eating saturated fat, take oils that are having unsaturated fats. So it's not every fat that is bad. We have saturated and then unsaturated.
Fat.
The unsaturated fats, examples of it in the oils, we have things like canola oil, olive oil, sunflower oil, and the like. So actually, when you take the holistic approach, it's very good. And also, in terms of even the meat that you are supposed to take, it will recommend that you rather take lean meat, instead of taking more of the red meat. And the lean meat contains less cholesterol. So the lean meat is more of poultry. Poultry meat contains less cholesterol as compared to the livestock meat.
Poultry is akokonam.
Yes, akoko, akonfirm, turkey, and even that one, when you're even taking it, the skin contains the most portion, about 80% of the fat.
Dr. Oppong, don't do that. The skin to the sweetest portion. Don't do that. Me and the Chicken Skin Lovers Association, we are not happy with it this morning. You should remove the skin.
Remove the skin, and when you are removing it, I'm sure you'll be removing it in tears.
You like the chicken? It's just the skin that I want to. Please don't follow my example. So we should remove the skin.
Remove the skin that contains most of the fat.
Oh, Charlie.
And eat the raw meat.
This one is hard for me, but agreed. No, you see, the healthy food options, they are hard. Though.
They are very, very hard. Imagine another one like taking milk. You realize that to recommend that take in the skim milk or the one that are evaporated. Those ones too don't taste so nice.
No.
Compared to the one that are
the full cream.
Full creamy.
It's Dr. Oppong is worrying me.
Even the bread, sugar bread and those other ones are very sweet. They are very, very nice.
Oh.
But imagine you go and take, they will tell you take the one that have whole grain. Whole grain has to do with the wheat bread.
No, me I eat banana bread.
It's not very nice.
No, me I eat banana bread. It's baked by a pharmacist, so I suspect it is healthier. Yes, I eat banana bread. It's baked by my colleague here at the radio station, Francisca Taylor. She makes banana bread. That one, the Francisca, I'm sure is healthy. No, you see, the healthy food options are very difficult for people to follow.
Yes.
Like I say, whole grain, skimmed milk, skinless chicken.
The rice.
Don't go there.
Don't eat polished rice. Perfume rice is polished rice, and that's what we.
That's what we all find.
Yes.
Or you should eat the local brown rice.
Eat the local brown rice, which is whole grain rice.
Okay.
And that one too is not as nice as what we are already familiar with.
Please,
Oh, it's nice, oh.
please, is wache. Does wache qualify as local rice?
This is wache. So the wache qualifies as local rice.
Okay. Yes.
But I think there's one basmati rice. That one is having a low caloric index.
Yes.
That one is nice, but
Yes,
it's expensive.
it's expensive. But I think that I mean, personally, I have switched to basmati rice because of my hypertensive risk.
Yes.
I've switched to basmati rice for like a year now. It's a bit hard on the pocket, but if you contact me, I'll show you some location where you can get some at a very affordable price. But it's healthier, to be honest. It's much healthier. So someone asked a question earlier about, there's always a conversation about hypertension and salt and then diabetes and sugar. So what he was asking earlier is that, is it true, and can you tell him the truth now? Because you see, sugar too, we have moved from white sugar to brown sugar to sugar substitutes, these sweetness. Now we don't know what to eat anymore. Because I think there was a time I was buying only brown sugar. And then someone saw me and said, Doctor, but the brown sugar, it's even more problematic. Stick to your white sugar.
Yes, because when you look at the component of brown sugar, you see brown sugar is actually white sugar. That they've added you see when they are doing sugar, there's the last portion is what we call the dark strap molasses.
Mm-hmm.
So the dark strap molasses is like honey. It's very thick.
Yeah.
And the same white sugar, then they'll use that dark strap molasses to color it. And they will tell you brown sugar is healthier than white sugar, but it's basically the same thing you're eating. So brown sugar is not as healthy.
Dr. Oppong, so now what sugar should I eat?
Well, if you compare the white sugar to the sweetness, some of the sweetness contain aspartame.
Aspartame, yeah.
And some too contain sulfatam. And those ones are having more or less like some protein component of it. It's not everything that is essentially glucose, but it has some protein components. And some too are from plants like stevia, but just that they're able to sweeten stuff. Those ones, let's say if you are diabetic and you are taking those ones are better because at the end of it all, it's glucose we are talking about. That's going to raise your blood sugar. So if what you are taking is not going to produce glucose at the end, and it's still going to sweeten your meal, I think those ones are fair enough substitutes.
I think I've seen the one you're talking about. But I'm spending some time on this because I think a lot of the risk factors that are modifiable are things that we do to ourselves. Like you see, when you're buying oil, for instance, and you go to the shop, you see, you look at the price first before you look at what is in the oil. That is the honest truth.
Obviously.
No, you look at the canola oil and you look at the 1 liter and it's like 80 cedis. And you look at the one that will cause problems for you and it's like 30 cedis. I tell you, you're not bring the 30 cedis one. It looks like to eat healthy or to stay on something like the DASH diet or a healthy diet is expensive.
Yes.
It's expensive. Well,
It's expensive.
Dr. Kwarteng.
So I wouldn't say that it's all expensive. I can tell you a story of this village that I went to some years back. That was in 2016. And there we measured the blood pressures of all the villagers, and we didn't really. We had only one person in the whole community with hypertension. Yes, just one person in the whole community.
I see.
And these are people that are not living affluent lives. So I think sometimes I would like to say that, the cost of health of getting a disease is probably far more expensive than the amount of money that you may spend on the food. However, there are always good, cheap, healthy alternatives anywhere. So it's not like if you are poor or you don't have enough money, then that's your end. Because even people that are in those communities who don't have access to a lot of things are still having low blood pressures. So I think it's mainly not with money per se. I mean, money is an issue. Yeah, that one is an issue. But there are like other alternatives that you can take in, which may not be as expensive and still healthy to take. So I don't think we should put everything on money per se.
Okay, so somebody is corroborating what you're saying right now. Good morning to you, Audrey. Audrey is saying that when it comes to the diet, I feel that a lot of the diets in the rural/poorer parts of the country are healthier than the diets that we have in the affluent parts of the country. I'm saying that simply because you can tell that some of the diets in the rural parts have more nutritious components. Have more nutritious components. So he's saying that I will live in the village any day. Are you sure?
No,
Are you
I
sure?
think those people, especially there are certain areas where we went. I think one important factor is that they are not really close to where it's quite easy to get access to salt. So that may also explain it. Again, if you take a lot of salt, where salt is, fluid follows, right? Where salt is. So once you take a lot of salt, your blood pressures are more likely to go high. And again, there too, they are eating the raw stuff, right? They don't have access to most of these things in bottles, right? They are eating the raw stuff. They are eating the vegetables. They are eating the fruits, right? And all these are helping. So, I mean, I don't think money is always an issue, but we shouldn't. It's like we shouldn't think that if you don't have money to buy this particular oil, to buy this particular thing, then that's the end. No,
But I think if you have an active lifestyle too, I think it helps.
That's also very
active
helpful.
lifestyle helps.
But if you have an active lifestyle, please, it's not from walking from your office desk to the water fountain and come back to your office. That's not active lifestyle.
You have to sweat.
Like you have to sweat.
Oh, they are eating their contumely and all that. So all those green things, they help them.
Solar lecturer says that, SOA or SOA lecturer says that, okay, I think it's a TV. SOA lecturer TV says, I love Dr. Fred's submission. Papa Fahuzi is sending some fire emojis. Pound Sterling says, I'm live and listening to you guys on my radio. Good work. Thank you for doing that. Good morning to Rob, and then Gyabaah, and then Maxwell Nina. Okay, I hope I pronounced it properly. So, I mean, we've talked about all of these things and everything, but we have people who are already hypertensive, for instance. They are already diabetic. They are already overweight. Like, somebody has been hypertensive for the past 10 years. Okay, he's been diabetic for the past 10 years. Those people are at risk of developing a stroke.
Yeah.
How does somebody who is hypertensive, prevent a stroke? Like, how do they prevent it? Because we've talked about how to prevent yourself from getting hypertension. What about those who are already there? They're already hypertensive. How do they prevent themselves from getting a stroke?
So for those who are already hypertensive, the first thing they can do to prevent themselves from getting a stroke is to take their medications religiously and make sure that they are checking their pressures every time, often. They are often checking their pressures. Even if they don't have the machine themselves, they can go to nearby facilities, hospitals, pharmacies, healthcare centers to check their pressures so that they will know their status. It's not just taking the medications without checking your pressure. Because if your pressure goes high, it puts you at a very high risk of developing a stroke. Another thing is that they should also have routine checkups some checkups will help them to even know their heart status, because the hypertension can affect their heart. It can cause them to get some cardiogenic diseases. And if they don't know these ones, how would they prevent it? So the regular checkups also help. And then aside that, the dietary approach to stop hypertension that we are advocating for is not only for those who want to stop hypertension. Even if you want to prevent a stroke, you already have hypertension, and you still stick to these dietary modifications, you exercise, you stop this late night eating.